I see you.
You see us. Can you hear us?
Hear you as well.
I think we're in business then. Well, thank you so much for taking the time to talk to us. We really appreciate it. We know you're very, very busy right now.
Feels like it's just never ending, but we're all busy.
Yeah, I can imagine. Well, let's get right into it then. I mean, we wanted to start by just taking a little bit of a look back and then a little bit of a look forward and kind of talk a little bit about what you're seeing for the next couple of weeks, couple of months. But to start, just to look back a little bit, back on March 25th, the health commissioner had warned of exponential growth in coronavirus cases, and that seemed to be influencing a lot of the decision making. Now that we're kind of on the other side of the peak, less than a month later, we've ended up even below the best case projections, and we're kind of wondering. Knowing what you know now, would you do anything differently given how we've seen the trends play out?
Well, it's easy to play Monday morning quarterback on anything of any sort, and I think this is a prime example of. Of course, we would do things differently if we'd known what was coming. I think we as a country would have done things different as well. I bet if you asked any other country, whether it's Italy or Spain or even China, would you do something different? And the answer would be yes.
Right. And now that we are at a very different point in this crisis, I mean, we're seeing things that seems like may have been hard to anticipate back at that time. Things like the food distribution that we're seeing such a huge demand for that. And then we have these, medical surge facilities that have been built that are largely sitting empty. Do you think that there are ways that those resources may have been allocated differently or different ways that you would have prepared?
Sometimes you're a victim of your own success as well. I think we took early measures, made tough decisions, implemented earlier, put restrictions in places that other states did not. So our numbers are showing we're down below what we expected. That's good news, right? I mean, we want that to happen, but it could have gone very differently if we could magically go back and after seeing all this happen, would we do things differently? Of course we would. But I'd rather be safe than sorry.
Obviously, unemployment's one of those areas where there's been a tremendous impact that would have been all but impossible to anticipate a few weeks ago. You talked at today's press conference about there's sort of a continued issue with a backlog, new reasons, but still the same issue. I was wondering if you think that the Department of Labor could have been better prepared for what was coming its way.
Well, almost the same answer. Did any of us anticipate there'd be 90,000 people unemployed in a matter of about a month and a half? I dare say no. Maybe we should have. Maybe we should have done the math and figured this out. But this has overwhelmed the system we have in place, overwhelmed the labor department. We're seeing it across the nation in other areas as well. It's not unique to Vermont, but certainly we wish we could have done better. We wish we'd been better prepared. Some of that could have been action taken 10 years ago. We've been talking about replacing the mainframe for over a decade, and we haven't done it because of the cost and because of the low unemployment in our state. We were bragging about being the lowest unemployment, 2.1% in Vermont. Now that's risen to probably well over 20%. So when you think about pre-COVID, in terms of the number of people, we had maybe 5,000 or so on unemployment. We had 15 at the call center, 15 people at the call center, going from 5,000 to 90,000, and then trying to scale up to the number of people calling in. But even with our scaling today, having by the end of the week, we'll have 300 people on the call center. That may not be enough, but that's equal to what we had. If you do the numbers, that's equal to what we had when we were processing 5,000 claims.
And when do you anticipate that this backlog will sort of be cleared and that will be the way that you sort of move forward?
Well,
and then what are the sort of longer term fixes to prepare for the next wave of potential claimants?
Again, what we're doing at this point, and I should add as well to the complexity, is the PUA, right? I mean, this is something that Congress did appropriately, included those who've never paid into the system. That's been further complicating everything that we're seeing today. So moving forward, we're going to scale up further. We're engaging with Maximus as we speak to see if they have the resources to scale up further so that we can put more people on. I believe that once, and we've taken care of the vast majority of those who have applied for unemployment, but we still have too many people that are not taken care of because they have complex issues with their claims. If we can take care of them and we can start putting people back to work, which we've done as well, that's going to take some of the pressure off. So the combination of scaling up further, taking care of some of the issues, and putting people back to work should help alleviate this in the next couple of weeks.
When the state colleges closed, you talked about how this was sort of an indicator of the harsh economic reality that Vermont was facing. I think you described the colleges as the tip of the iceberg when it comes to economic impact. And I was wondering if you could describe what you think the rest of that iceberg might look like in terms of which sectors of the economy are really going to be crushed by this.
I think all sectors of the economy are going to be affected by this. I don't think anyone is left untouched in some ways. But when you consider, we saw I'm sure you reported on some of this, but UVM Medical Center, for instance, their budgetary issues, they have a fairly significant gap right now because they weren't able to do elective surgeries. They had capacity, but weren't able to because we didn't know what was coming. And we wanted to make sure that they had the capacity to take care of any COVID patients that came through their doors. That, when you consider that's one, albeit they're our largest hospital or network in Vermont, but there are a lot of other hospitals in the same condition. So I would say on the healthcare side, that we're going to see huge challenges and the amount of resources needed to make sure that we keep them viable, keep them going, keep their lights on in some cases, because they weren't exactly in a strong position before COVID, some of the hospitals around the state. And this has just made the problem that much worse. So I think the healthcare system is going to be challenged along with higher education. Tourism is going to be challenged across the board, whether it's bars and restaurants or whether it's the activities associated with that. Again, across the board, we're going to see significant changes to the economy.
You talk about these tremendous challenges, and then at the same time, there's these revenue projections that are, as far as the state's budget goes, I think that the state's economists, their initial projection is something like $430 million for the next fiscal year is going to be lost from what was expected. How do you rise to meet those challenges when you're facing that opposite sort of challenge of not having the revenue to do it?
Yeah, and you have to prioritize, and it's going to be very difficult on all of us in order to do that. That's why I'm advocating that we be very careful with this $1.25 billion that we received from the federal government that has a lot of strings attached to it. But we need to make sure that we're utilizing that money to the fullest advantage. That we take a look and see what we can use it for to leverage maybe other assets, and then again trying to put people back to work as quick as possible to bring so that income starts flowing again. So it's going to be all hands on deck. We're going to have to be very creative, and I don't know what the federal government's going to do either. I mean, there's a move in Congress by some of our delegation as well, who are trying to get relief for states in terms of their budgetary issues. So we'll see what happens there, but we can't count on that.
Do you think if major federal money does not come through, I mean, what sort of situation would Vermont be facing if you didn't have that sort of outside assistance?
Well, again, you have to prioritize want versus need. Take care of the basic necessities. Like the food, shelter, water type of thing approach, and we have to do that with state government as well. I'd say our healthcare system is pretty important to us. We need to make sure that that's viable, and that we can support the public safety of our citizens. And then we just work our way down from there. I mean, this is, again, it's going to be very difficult, but I think we'll get through. We'll make our way through. We had a good fiscal year 20 going. I think we were going to have a surplus had we not had the coronavirus hit us. We were going to have a fairly decent surplus at the end of the year. Obviously, that's not there anymore, but we were in a pretty good position to I think, be able to get through this without a lot of pain in 20. The real pain is in fiscal year 21, which we're going to be dealing with now and starting in July.
When you talk about the urgency of getting people back to work, I wanted to ask about with these Restart Vermont measures that you've been rolling out, these kind of weekly quarter turns of the spigot, as you've been calling them, these incremental steps. One thing that I'm curious about is, way back in early March when we first started having these incremental measures to shut things down, we were hearing a lot about this 2 to 3 week window where it took a certain amount of time to see the effects of what was happening because of people taking an amount of time to show symptoms and then get tested and get confirmed. I wonder why we're not hearing about that now. How can you be confidently rolling out new loosening measures every week?
Well, I think the concern is still there. I think, and maybe I haven't verbalized them accurately, and maybe I haven't been communicating well enough, but I have a big concern about that. That's why we're doing it so slowly. That's why we're watching the data. That's why we're every move we take. Plus the fact that when we put some of these sectors back to work, that we have such rigid guidelines, and that this is really an educational process, and making sure, like in manufacturing, making sure that they're taking temperatures when they come in, if we can get the thermometers that they need to do that, but at least surveying them, social separation, alternating breaks, alternating lunch breaks, and so forth. I mean, and even alternating the times when they come into work. I mean, there's all kinds of things that are in their guidelines that they agree to and work towards to work safely. So it's going to be a learning process for them. But we have to make sure that we don't allow those numbers to spike. That we catch things early enough, and that's why tracing and testing is so important as well. Something that we didn't have the capacity in the beginning, that we're building up the capacity now. So we want to be more proactive in our tracing and testing, so that if we see a problem, that we see someone who comes into work and maybe has an elevated temperature, that we can report that, see their doctor, and get tested, and then trace as well, so it doesn't erupt into something more significant. So I'm still concerned about that. That's why we have to watch the trending to make sure that we're not exceeding the capacity of our healthcare system once again, and that we don't have to pull back. I would rather just slow down rather than pull back from opening up the economy.
There's been, a lot of debate about the exact timing of these types of measures. Something we're hearing both from members of the public. It seems like there's these two camps, people who are really, really eager for these reopening measures to happen quickly. Others who are very, very cautious and want to see things move really slowly. And it seems like those two camps are really at odds with each other. Like, you're just not going to be able to please both of them. And I'm curious to hear both how you go about trying to manage those competing interests, and also among your administration and staff, what are the conversations like? Because I have to imagine that there are some competing interests just in the folks that are in your cabinet and working on this problem.
Yeah, well, trying to please both extremes in both polarized camps, so to speak, has been what my political life has been like. Is someone who's a centrist and a moderate trying to get work down through the middle. You always have those extremes, and this is the case today. And I go in accepting that I'm not going to please everyone. But I'm going to do what I think is right based on the information that I'm receiving. In terms of the team, we don't always agree. We don't. But we have the conversation. We debate this. We work things through. But we come out with one solid approach, and I think that's what has been the strength of our team. Again, I don't need people who just want to agree with everything I'm doing. I need them to challenge me, and they do. But at the end of the day, we work it out, and I'm comfortable with the position and the approach that we're taking.
Do you have an example of a time that you felt really challenged in your approach to these reopening steps?
Oh, I think every time we make a decision, I think it's the right thing to do. But I worry. Are we going too far? Are we going too fast? Should we be slowing up, or should we be going faster? I mean, I have these, internal thoughts all the time because it's uncharted territory, and you're taking when you have that when you're debating this and you're rolling out these openings. I am concerned again that we don't have an outbreak, that we don't have further increasing of the numbers and more deaths in our state, and so I'm very very cautious in that regard. Maybe too cautious in some respects, but again, as I said in one of the press conferences, I'd rather be accused of being too cautious than having to look in the eyes of a family member and know that I caused some harm to them or caused the death of someone by being too reckless. And I don't think we can be accused of being too reckless. I think we've done things as well as we could have done with everything that we had to deal with.
One thing I've wondered in terms of kind of being on the cautiousness versus recklessness scale is that you've really emphasized that with some of these measures that you've talked about, the things that employers are going to be required to do or the members of the public are recommended to do, you really emphasized education over enforcement. And we do wonder, what do you say to people who think that an enforceable order on something like face masks or on some of these recommendations to employers, that would have more of an effect and do more to kind of mitigate the spread here?
I've always promoted the idea of more carrots, less sticks. I think more education, more adoption, more compliant, at least more compliance. I think we've seen that here in the state. We're one of the, I think, leading states for compliance, and we haven't had to do a lot of enforcement because people have done the right thing. Even begrudgingly done the right thing. They may not be happy about it, but they've done it. And I can't thank them enough because it's literally in our hands, right? I mean, some could become reckless, some could do the wrong things, but we haven't been challenged as much. I mean, I'm not saying that it doesn't happen at all, but we haven't been challenged like other states have. And so we need to reward that at the same time. So if we're doing the right thing and we're staying socially separated, and we're wearing our masks, and we're doing taking all the appropriate measures, we should be able to open up as well and think about the how. How do we open up businesses? How do we act in recreation settings and so forth? How can we do this differently than we've done it before? And I think that putting the contractors and construction workers, the manufacturers who are accustomed to having oversight and a lot of regulation around what they do, giving them a higher level of oversight and regulation will lead to them educating others. So if we have this team of 50,000 people that are in the workforce now that understand how important it is to socially separate and wear your masks and to take your temperatures and what that means and how quickly this can be transmitted and so forth and so on. that leads to others adopting this. That leads to families adopting it. And it just creates a movement, I believe, that's much healthier than trying to take the other approach, which is enforcement. You know, I'd rather lead than drive, if that makes any sense. I mean, I'd rather have people want to do it for the right reasons than to force them to do it. And I think that it's been successful so far.
Can you imagine a scenario in which you're thinking would change on that, public health data or something else that would make you convinced that an order was more appropriate?
Well, I don't believe so, because we've seen thus far that it's working, and we're actually on the other side of it. So rather than continue to talk about enforcement, when we see education is working and compliance is there, why would we want to go backwards? Why would we want to take a different approach? Because even with enforcement doesn't mean that you're going to accomplish your goal, because then there'd be resistance, and then there would be people doing more reckless things possibly. So I think the approach we've taken has been appropriate for Vermont. Maybe not everywhere, but it's worked for us here in Vermont.
So summer's approaching, weather's getting good here. You talked about summer camps today, questions about people coming to second homes, about tourists. Based on that same feedback Mike was talking about from our readers and what I understand you're receiving as well, it seems like people are really concerned about folks from Connecticut, New Jersey, and New York heading up to Vermont for the summer. I'm wondering, do you foresee those parts of the economy operating in some limited way this summer? And how do you sort of balance that with concerns about people coming and perhaps spreading the virus?
I certainly hope that we can get back to some sort of normal eventually, but it won't be instantaneous. It'll be a measured approach throughout the summer. When you look at how things have changed just in 2 months, I mean, it was less than 2 months ago that I signed the state of emergency. We announced that, I think it was then, that we had our maybe first deaths, maybe 2 months ago. How things have changed drastically since then. Think about what could happen 2 months from now, and it could go the other way. So again, if I can advocate for more compliance, doing the right thing, making sure we're taking care of things, that the tracing and testing is going to be essential as we move forward, then maybe we can get back to something that's close to what we had, and without fear of the spread of the virus. But understanding that we rely on tourism here in the state. It's a big part of our economy. So trying to balance that out and keep people safe, I think is the trick, and it's a very difficult needle to thread.
And right now, people coming from out of state have to quarantine for 2 weeks. It seems like that would be really complicating for things like summer camps and vacations, that kind of thing. I mean, do you think maybe that would be lifted this summer to open things up a bit?
I think there's going to be some movement on that as well. Maybe with, again, more increased testing, there might be an opportunity to do some more of the spot checking, so to speak. And then when we do see something that flares up, that we'll be able to contain it. There's all kinds of things that we can do. It's a bit of a new age, new world, and we're seeing again industry reacting and coming up, and technology changing. So who knows what it's going to look like 2 months from now? But I would dare say it's going to be much different than it is today. And probably, I would think testing would be a big part of that.
Great. Well, thank you so much for taking all this time to talk to us.
Yeah, I appreciate it. Thanks for all you're doing as well.
Thanks again.
All right.
Great. Thank you for your time, Governor.